Hey there, is your bowel doing well or is it giving you trouble today? We're going to talk about the 7 signs of colorectal cancer and why it's essential to know about this type of tumor. It's simply because colorectal cancer is the 3rd most common cancer and the 2nd deadliest. About 10% of cancer deaths are caused by this tumor, so stay tuned. I'm breaking this into 2 parts to make it easier to follow and understand. First, we'll cover the signs and symptoms of colon cancer. You know, the warning signs you can see or feel that tell you something's off. These symptoms can range from changes in bowel habits to unexplained weight loss and fatigue. It's crucial to recognize these early signs to seek timely medical advice. In the second part, which I think is super important, we'll dive into prevention, habits you can develop, and foods you should eat to reduce your risk. This includes incorporating more fiber-rich foods, regular physical activity, and avoiding processed meats. Small lifestyle changes can make a big difference in your overall health. We'll also talk about polyps and why colon cancer is increasing among younger folks under 50. Understanding the role of polyps and getting regular screenings can help in early detection and prevention. This is going to be a comprehensive video, so stick around till the end. We promise to provide valuable information that could potentially save lives. Don't miss out on any part of this important discussion. Symptom 7. Changes in bowel habits. This can be a subtle sign that something is amiss in your digestive system. It's very important to know your bowel habits. Keeping a journal can help you track any changes over time. Some folks go to the toilet right after breakfast. This is often due to the gastrocolic reflex, which stimulates bowel movements after eating. Others go 2 or 3 times a day. This can be perfectly normal depending on the individual. Some go just 2 or 3 times a week. The key is consistency in your own pattern. What's your bowel pattern like? Reflect on your habits and note any deviations. If you notice any changes, pay attention. These changes can be early indicators of underlying health issues. Bowel changes are common, but beware. They're not alarming by themselves. However, they should not be ignored. If these changes continue or worsen, you should see a doctor. Early detection can make a significant difference. About 65% of people with bowel cancer experience changes in their bowel habits. This statistic underscores the importance of monitoring your bowel health. These changes can vary and depend on the tumor's location, size, and stage. Early-stage tumors might cause different symptoms than advanced ones. Stools may change in consistency or color. They might become looser, harder, or change in hue. People might start going to the bathroom more often or much less often. Frequency changes can be a red flag. The main change is often recurring diarrhea unrelated to an infection, which then switches to constipation and back again. This cycle can be particularly concerning and warrants medical attention. Symptom 6. Blood in stool. This can be alarming and should never be ignored. That's why it's crucial not to flush right away. Take a look first. Observing your stool can provide important clues about your health. Bleeding can occur due to various reasons such as hemorrhoids or eating beets, but don't just assume it's nothing serious. Hemorrhoids are swollen veins in your lower rectum and anus, which can cause discomfort and bleeding. Eating beets can also cause red or pinkish stool, but this is harmless. The large intestine has several parts: the ascending colon, transverse colon, descending colon, sigmoid colon, rectum, and anus. Each part plays a crucial role in the digestive process, and issues in any of these areas can lead to blood in the stool. If a tumor is on the right side, the ascending colon, stools may become black and tar-like because this section absorbs water from stools, making them liquidy initially. Black tar-like stools can indicate bleeding higher up in the digestive tract. The descending colon and sigmoid colon have smaller diameters and form more solid stools. Bright red bleeding might drip into the toilet after a bowel movement or show up when you wipe with toilet paper. Bright red blood usually indicates bleeding closer to the rectum or anus. A tumor could bleed because it ulcerates a blood vessel feeding it, or due to increased pressure on the bowel wall from straining too hard. Straining can cause significant pressure, leading to bleeding, especially if there is an underlying condition like a tumor or hemorrhoids. Always consult a healthcare professional if you notice blood in your stool to determine the cause and appropriate treatment. Symptom 5. Abdominal pain. If you've never experienced abdominal pain but now have severe cramps that come and go repeatedly, or pain while defecating due to a tumor affecting part of the rectum, seek help promptly. Symptom 4. Fatigue and tiredness. Symptom 3, abdominal bloating. Bloating happens if tumors partially or completely block the bowels, causing gas buildup. Symptom 2, unexplained weight loss. Sudden weight loss without lifestyle changes. Watch out! The first symptom, that uneasy feeling that your bowels haven't completely emptied. It's what we call tenesmus. But wait, before we dive in, go and like the more you like, the more YouTube will share it with those who don't have access to doctors' hospitals. Also, share it with your friends and family. Your small action can save lives. So don't be shy, share it. You go to the butt, feel like something's still there. Like not everything came out and you need to go back. Yep, that's tenesmus. It's this uncomfortable feeling of incomplete evacuation even after a full bowel movement. There's nothing left in the bowel, but it feels like there is. This can be a common symptom of bowel cancer. Tumors may partly or completely block the bowel, making it feel like there's stool when there's actually a tumor. When this happens, stool shape might change. They could become thin and ribbon-like because they pass through the middle of the tumor. Oddly enough, many people with colon cancer don't have any early symptoms. Not having symptoms is fine, but know your risk factors and consider colorectal cancer screening to see if you have polyps. Wondering what colorectal polyps are? Well, colon cancer develops from certain polyps lining the colon's mucosa. These mucosal cells mutate and could become polyps. Most don't turn cancerous, but some might over time. It usually takes about 10 years for a polyp to become cancerous if not detected and removed. What are the risk factors for bowel cancer? Why is it increasing among young people? Like many diseases, it has several factors. First up, age. As we get older, our defense weakens. A dormant polyp plus a weak immune system can turn cancerous. Second, inflammatory bowel diseases like Crohn's or rectocolitis boost risks immensely. 1 in 5 patients might develop colorectal cancer. Third, genetic syndromes such as Lynch syndrome or familial adenomatous polyposis also heighten risks. Plus, if there's family history, father, mother, brother, be concerned. Taller folks too are at higher risk. You can't change that. Now for things you can control. Cigarettes. Don't just increase lung cancer. They up tummy, bowel, mouth, and other cancers too. Alcohol too raises colorectal cancer risk. Also important, a sedentary lifestyle. We need exercise. Diets scarce of fruits and veggies, low fiber, and packed with ultra-processed foods harm you as well. Processed meats like salami, ham, bacon, you name it. Too much red meat and saturated fat isn't good either. So why is colon cancer soaring amongst younger people? The American Society for Preventive Medicine has lowered initial colonoscopy age from 55 to 45 due to bad eating habits, industrialized foods aplenty, sedentary lifestyles, and rising overweight obesity rates. How can you protect yourself against colon cancer? Here are 7 tips. The last one is super vital, so stay till the end. First tip, drink lots of fluids, especially water, for better bowel function, avoiding constipation, so toxins stay less in contact with your colon lining. Second tip, eat plenty fruits and veggies. They contain fiber and antioxidants, improving stool speed, reducing toxin contact time, and also bettering intestinal flora. Third tip, limit red meat consumption, particularly processed meats. Fourth tip, use natural anti-inflammatory spices like turmeric and cinnamon. Fifth tip, drink milk and dairy products, which recent studies show prevent colon cancer, though avoid if lactose intolerant or allergic. Sixth tip, exercise. It regulates hormones, reduces inflammation, curtails stress, all help prevent cancer. Seventh tip, and most crucial, get regular checkups. Have at least your stool tested for occult blood yearly, or go for colonoscopy beyond age 45 with intermediate risk where polyps can be found and removed pre-cancer development, unlike mammography diagnosing already present cancers. Prepping for a colonoscopy isn't fun. You must clear your bowels taking laxatives until nothing's left. But during sedation, discomfort vanishes as doctors insert a thin lighted tube through anus housing camera for examination, removing polyps or biopsying larger tumors if needed. There you have it. Thank you for watching. Stay healthy.